Hello, my name is Valerie Wood, and I'm your instructor for Seminar and Social Work Practice. Welcome. In this intro video, I'm going to give you a brief orientation to the course and offer some guidelines so you'll know what to expect. I'll also tell you a little bit about me and my background and some thoughts on why I think this class is so special. I believe it's really important to consider at the beginning of every course how that class will enhance your work, what your expectations are, and what you'd like to walk away with. You all know your coursework builds upon the core competencies of the profession and supports your learning and practice behaviors, but what does that mean specifically as it relates to this class? At this point in your education at Fordham, you have a strong foundation of skills and many hours of field where you've had the opportunity to apply and expand those skills. You're less the student or the intern and should really be feeling more at home in the role of social worker. So while you don't have your degree yet, you are professional social workers. You've had the learning opportunities to fulfill the role, a role which enables vast opportunity. In this class, you'll get to show us your stuff. You're going to present a case. This is based upon a standard format which you'll be provided with, but it really doesn't vary much from place to place. You will present the data, the assessment, your case formulation, including its theoretical base, DSM-5 diagnosis, treatment plan with evidence-based practice interventions, outcomes, and projected termination issues. You'll have the opportunity to pose a question or two, process an intervention, or request feedback, request feedback from the team and follow-up. Maybe there's some particular issue about your case that's been troubling you, something you just can't put your finger on. The therapeutic relationship may need an objective view, or there's some anticipated conflict related to termination. We can offer a third eye and a safe space where you can really just let it all hang out. So if you're not doing this already in field in one way or another, you will be soon, even if it's informally discussing cases with colleagues. Here you'll have an opportunity to work with a clinical team in a learning environment, no judgment. You'll have the opportunity to see a case presentation of mine. After that, you'll have the opportunity to respond to my presentation with questions and comments, much like your peers will respond to yours. This will give you a model for how to construct your feedback in response when you do your own case down the road. So let me tell you a little bit about me and my background. In addition to teaching this course, I've taught Advanced Clinical Assessment and Diagnosis 2 at Fordham. I'm also a field faculty advisor here. I really appreciate that opportunity because it gives me the chance to participate in the field aspect of your program. Prior to coming to Fordham, I was with another graduate school of social service where I taught courses equivalent to generalist practice, levels 1 and 2, and assessment and diagnosis 1. I also had the opportunity there to provide advisement for integrative seminars 1 and 2, and I did some field coordination for the Northeast region where I placed students in field. That was an online program. My clinical background is pretty diverse. I spent 7 years at a suburban hospital working in the psychiatry department doing crisis intervention screenings in the emergency room. And I did it nights and weekends on call. That was really interesting work. Some of you know, or you all should know, crisis screening is very different than standard psychosocial assessments that you would do with a client that you're meeting for prospective counseling or in another setting. Maybe somebody is working in crisis and will present a case and we'll have an opportunity to talk some more about that. Following this position, I went to an inpatient substance abuse facility located in an urban setting, and I provided, or the facility actually provided care for low and no income clients and the criminal justice population. The services were inpatient detox, short and long-term residential, and outpatient. My role there was senior clinician, and I supervised all of the master's level clinicians and specialized in working with clients who had co-occurring disorders. I was responsible for running groups, identifying high-risk clients, and worked with the most complex cases. I really liked working with that population. After this, I went to a suburban community mental health agency And as clinical director there, I diversified a little and did less face-to-face work with clients. I supervised the clinical staff, and I got involved in program development, strategic planning, and board development. There are a lot of things you can do with a degree in social work, and you really have the opportunity to kind of go where your interests take you. So from here, I went to the University of Southern California, where I was full-time for a while, and then I focused on my private practice. I've had my private practice since 2005, maintained that throughout everything I've done, and I still have that now. Most importantly, I have 3 teenage boys. One is a sophomore at George Washington University. I have a senior in high school and a junior in high school, and my boys are the greatest. There is a curriculum for the course, which is outlined in our syllabus. This is posted on Blackboard, and I'd like you to spend a significant amount of time with it. We will refer back to it throughout the session. Please contact me immediately if you have questions. My contact information is all over the place. It's in the syllabus. It's on Blackboard in the About Me section. It is on the announcement. I've emailed it to you. Don't hesitate to use it. That's why I keep sending it to you. Over the next week or so, you'll hear from me regarding virtual office hours, and hopefully I'll be able to schedule a couple of live sessions soon. These are optional, but I really hope you'll attend. If you haven't recorded your voice thread yet, please go do that as soon as possible. I'm looking forward to hearing about you, and I'm sure your peers are as well. So here we go. This is going to be great. I hope you're looking forward to it as much as I am, and I will see you soon. Thank you.